not I'm not the best when it comes to technology.
You're fine.
All right.
I don't think any of us are.
All right. Let's
Speak
see.
for yourself.
Okay, buddy.
Lumping me in there like that. Come on now.
All right, there should be up. Here's share screen. Okay. Share.
Oh,
And let me put it to, there we go. Can everybody
very
see
cool.
this?
Yes.
Yes.
All right, let me move this. Come on, there we go. All right, so thank you all for coming. I'm so happy to have you for my music therapy presentation. Today I'm going to be talking all about music therapy and how it can help children, especially children in the youth ministry. Let's see. So today we're going to talk a little bit about what music therapy is, what the difference between a music therapist is versus a music educator or music performer. We'll talk a bit about how music therapy works in general, how music affects the brain and the body. Then we'll also talk about how music therapy helps children specifically and children with developmental disabilities like autism and ADHD. Then I'm going to go over how the music therapy treatment process actually works, like what music therapy looks like working with a music therapist, just the assessments, the treatment plans. And finally, I'm going to give an intervention example, show you what an intervention looks like when working with a client. All right. All right, so what is music therapy? Well, according to the AMTA, otherwise known as the American Music Therapy Association, music therapy is the clinical and evidence-based use of music interventions to accomplish individualized goals within a therapeutic relationship. So that's a lot of definitions in there. Essentially, what it means is that music therapy is the purposeful use of the elements of music in an intervention to meet the specific needs of a client. We use When we're using music in a music therapy session, we're not just using random songs and just playing music and letting music magically work. We're actually thinking about the different elements of music, how rhythm can help our client with maintaining focus or maintaining a physical exercise to help them feel more energized. We're also thinking about how music can guide a client into how different key changes can guide a client to redirect their thoughts and their emotional state, kind of reorient them, regulate their emotions. And we basically, it's how the elements themselves can help treat the whatever specific need that the client has that we're working with. So here's a good example that I have. Let's say I have a child with cerebral palsy, which is a neurological disorder that affects the child's physical ability to move. It will affect their posture and muscular strength. They'll have difficulty moving their arms and walking. Um, and This child's parents want me to help improve her posture and muscular core endurance so that she'll sit up straight. In a music therapy setting, I would use an intervention that would help guide, that would encourage her to exercise her core by reaching over to touch different instruments. Use So let's say I had two drums on the opposite side of her. To help her maintain her core posture and exercise her core, I would have her use a mallet to rhythmically hit each of those drums while leaning side to side so that her core will be engaged and she will have to exercise. She'll have to engage in the exercise, but it's in a way that is positively stimulating. It's engaging for her in a way that's enjoyable. So what's the difference between a music educator and a music performer and a music therapist? So when people generally think of music therapy, they think that it's they think anybody can use music therapy because music somehow helps the clients feel better. And while that is somewhat the case, there's a lot more to it than that. Music educators and performers are trained in teaching and performing music, not treating clients in clinical settings through music therapy. They lack the clinical training necessary to help properly address the client's needs. And while music therapists are trained to understand music theory and provide quality music performances like an educator or a performer would, music therapists use those qualities as tools to facilitate healing for their clients. It involves a lot of different training requirements in order to become a certified music therapist. You first need to have a bachelor's degree in music therapy from an American Music Therapy Association approved program. And the coursework typically includes a general understanding of music theory, music therapy, music history, biology, psychology, social sciences, behavioral sciences, abnormal psychology, and etc. It also requires clinical on-the-job field training, working with clients in healthcare or education facilities. So while we're studying to become music therapists and understanding the logic behind it, we are also doing on-the-job training, working with real clients and applying these skills and intervention techniques that we're learning as we go. So we get experience working with children with developmental disabilities, children with neurological and physical disabilities, and people with geriatric disorders and those with psychiatric disorders, counseling, the list goes on. We also have to earn, after the fact, we also have to complete an internship, which extends to about 6 to 8 months of working with various different clients. And finally, after all of that, we have to earn a music therapy license by passing the AMTA Music Therapy Board Certification Exam, which is the baseline standard that it tests our level of competency in music therapy so that we are professionally trained enough to work with clients legally, safely, and effectively. So, how does music therapy work in a general sense? Well, in order for us to understand how music as a therapy works, we have to understand how music itself works. Now, music therapy can be a little bit hard to define sometimes, mainly because music itself is hard to define. In a lot of cases, almost anything can be considered music. Rhythmic tapping, that's music. Hearing different bell chimes at random, that's considered music. But essentially, music, despite all of the varying differences and extremely diverse styles and textures of music, at its core, music is a complex, multi-layered natural phenomena where various sounds and rhythms are placed in a purposeful and meaningful organization of patterns. So while there are tons of different sounds going on and there are lots of different stimuli involved in them, in order for it to be music, it follows a specific and rhythmic pattern. It involves many elements that come together to make an organized fashion of music, which involves pitch, dynamics, tempo, melody, texture, which is basically different tones playing at the same time. You can also have rhythm and timbre. There are lots of different elements that make music what music is. And all of those elements combined together in an organized fashion make what we typically recognize as artistic music. What's interesting about music is that it's also an audio-tactile sensation. So when we hear music, we're not just hearing it, we're also feeling the vibrations. That's how we perceive it in the eardrum. And that's those vibrations we perceive through the eardrum get sent as neurological messages to the brain, which also vibrates and stimulates brain activity. These vibrational frequencies, coupled with the complex organized patterns, causes the brain to engage in what's called neuroplasticity, which is basically the brain engaging in regeneration and repair of damaged neurons or old cells. It creates brand new neural pathways and is based at its prime, it is the best state in which it is to take in information, because at that point it's become flexible. It will absorb whatever information is being given. Let's see. Because of the brain-body connection, by the way we affect the brain, we can also affect the way we work with the body. So in the case with a child with cerebral palsy who experiences difficulty moving her arms or maintaining her posture, when we use music to stimulate her brain and engage in neuroplasticity, we're also teaching the body to respond positively to the music. Because cerebral palsy is a neurological disorder, by addressing the problems neurologically, we can also address the physical problems as they're presented. Any questions? Did that make sense?
Yes, it makes a lot of sense. I was wondering, as you were talking about the different types of children that you could treat. So like if you had a child that was excessively hyper, you would try to treat them with music tones that were calmer, like a calmer rhythm.
Yes and no. So if I was treating a child that was excessively hyper when couldn't sit still, couldn't go to sleep, I would first give them an activity in which they can just express kind of let out that excess energy that they have going on. But through kind of a dance intervention, it would be a highly upbeat intervention activity where the child can move around, dance, get all their energy out. And then I would transition that into a more lethargic intervention by slowly transitioning the intervention from a upbeat, energetic song to a more lethargic and calm one as a way to redirect the child from being super active to more lethargic.
Okay. Can you also use different rhythms and tempos to keep their attention?
Yeah, absolutely.
Okay, cool. Very
You
cool.
you can actually use rhythm as a way to kind of help not just maintain their attention, but also address different attention deficits. So if a child had difficulty with focused attention, I could use a rhythm activity where we create a pattern of rhythms and we play the said pattern together. We first play the we first play the pattern like this. 1, 2, 3, 4. And then the two of us can change how that pattern looks so that by taking out a beat or dividing a beat or just changing it somehow so that the child has to pay attention and make sure that they don't hit the wrong beat. So if we start with 1, 2, 3, 4, we can change the pattern to 1, 2, 3, 4. So they have to watch out for that beat. Otherwise, they'll accidentally play it.
Okay, very cool.
Okay.
So this would be for something like for someone who has ADHD, for instance, could be an effective tool to help them focus themselves.
Yeah. All right. Let's see. So, music in therapy. Music is used in therapy as a tool by which music therapists can facilitate healing for their clients, however the clients need. The therapists design their interventions using the elements of music to meet the client's individual non-musical needs, as we just kind of talked about. So some of the common treatment goals that music therapists are often asked that clients often come for is things like promoting general wellness with things like sleep and focused attention, managing your time, managing stress, learning how to cope with high stressful situations or difficult emotions that come with stress. We can use music to alleviate pain. And this one is actually really interesting. So there is a theory in the neurological side of music therapy called the pain gate theory, which basically means that when music is at the top of the spinal cord, there is a quote unquote gate in which all sensory stimuli regarding pain passes through to be processed and dealt with by the brain. When playing music, the brain can only focus on certain stimuli at a time. So when the person is only feeling pain and there isn't a whole lot of things going on around them, they're more likely to feel that pain because that's the strongest stimuli that they are receiving so far. When the brain is focused on a positive stimuli like music that kind of gives positive feelings and dopamine and relief in the brain can't focus on both pain and music at the same time. So when it focuses on music, it actually begins to close that pain gate up at the spinal cord, thereby reducing a person's sensation to pain. This theory has been used a lot in things like surgical procedures to help clients reduce their need for anesthetics or antibiotics and pain medications. There's tons of research actually supporting music being almost as effective as painkillers when it comes to reducing pain. Music is also used as a tool to help express and process emotions like depression, anxiety, mania, or just anger management problems. It can also be used to improve communication. So children with speech impediments or verbal communication disorders can be given music therapy to help work through the problems that are hindering them from being able to speak as effectively. And it can also promote physical rehabilitation, as explained with the child with cerebral palsy disorder. So here's a list of some of the benefits for young, typically developing children. According to the article, Learning Music Interventions in Child Development, a critical review and further directions, music therapy can enhance the development of typically developing children in the following ways. We can help them in cognitive functioning areas by teaching the child new information while their brain's neuroplasticity is being activated through music. This allows them to retain more information through memorization and enhances their overall cognitive functioning. So they're able to focus a bit more, they can retain more information they're being taught, like with ABC songs and nursery rhymes. Engaging in musical activities like rhythm games or improvisation stimulates neural pathways involved in executive functioning and spatial temporal reasoning. So basically what that means is it produces positive changes in the brain that allows them to think clearer and be able to improve their critical thinking skills and help them to kind of get a better awareness of their surroundings. It can also help them in speech and language. Music therapy aids children's speech and language development by improving auditory discrimination, awareness, and articulation through rhythmic singing exercises that engage the brain's speech production and processing areas. So by activating neuroplasticity, we can help children in learning new words and learning new songs and enhance their articulation capabilities in speech. It can also help them with emotional expression and emotional regulation. Music fosters emotional expression in children by creating a safe, nonverbal medium for children and for exploration and expression of feelings. So when they are using music, they can express themselves in a way that they're feeling. One of the great things about music is that you don't need words in order to be able to express your feelings with music. When you're feeling whatever you're feeling, you can just express it with whatever instrument you have, whether it be egg shakers, piano, anything. Musical activities such as improvisation, songwriting, and the like encourage self-reflection and emotional articulation. It helps them process and regulate their emotions by being able to express them, even though they don't understand how to verbalize it, and thereby allowing themselves to regulate and process what's going on. All right. So music therapy also has a lot of positive benefits for young children with developmental disabilities. Two of the primary ones being autism and ADHD. So in the case of autism, music therapy can help enhance speech and language deficits in children with autism by promoting vocalization, improving articulation, and encouraging verbal and nonverbal communication. So as you can see, one of the primary difficulties that children with autism face is verbal communication. They can kind of get their words stuck, or they can't get their thoughts together enough to say full sentences. Let's see. But anyway, it can also help with ADHD. Music therapy can also help children with ADHD symptoms by enhancing their focus, reducing impulsivity, and fostering emotional regulation. Rhythm-based activities help structure tasks and improve attention span while strengthening self-discipline. While musical improvisation offers a safe outlet for emotional expression. Additionally, engaging with music can strengthen self-discipline and boost self-esteem by providing achievable and rewarding goals. Let's see. So, how does applying music therapy work? Well, according to the AMTA, there's a specific clinical process in which music therapy treatment is conducted. So first you have the referral, then you have the initial assessment where the music therapist assesses the client's general skills and whole person. Then they develop a treatment plan based on established goals and objectives, where the music therapist designs interventions to meet those goals and objectives for their clients. And throughout the process, you have documentation. Documentation is the foundation for all music therapy procedures. It helps us to know how well our interventions are working for our clients' progression over the course of treatment, and whether the client needs increased goals and objectives, whether they've met them, or if the treatments that they are being given are not as effective as we originally thought. By the end of it, we have a final evaluation in which we can collect all information from all of the gathered documentation and compile it into a single progress report. We evaluate that and determine whether the client needs to continue music therapy, or if their symptoms are manageable enough that they won't need music therapy anymore, or if they need a different provider or a different type of therapy that would be better suited for their needs. Let's see. So anyone can refer someone to music therapy, be it a health professional, other therapists, or family members. Assessment generally focuses on the client's general areas of functioning, like physical, motor functioning, their cognitive functioning, their speech language abilities, emotional regulation capabilities, social skills, and music skills. They don't have to know how to play music, but knowing if they're interested in learning music can help make the treatment plan a little bit more tailored to their interests. Treatment plans are based on the goals and objectives set during the assessment with the client. So for example, we have improve speech complexity. The objective would be during a rhythmic song, client will verbalize 3 sentences with at least 1 word with 3 syllables within each sentence by a set date. So documentation is the most important part of music therapy and allows us to understand how well it's working, how well it's not. This is kind of an example of what a music therapy intervention would look like. As you can see, it's very meticulous and detailed in how the plan is set up, how it reaches the goal and objective, the potential responses to give if the client does not respond positively, or if they do respond positively, and how to kind of adjust the intervention based on their immediate needs. And then at the end of it, you have what we call the SOAP note, which is the subjective, objective assessment and assessment over the overall session, and plan for the next session. It assesses all of the important data gathered within the session and compiles it in brief but detailed information that allows us to understand what went well, what didn't work, and what we can do to improve it for the next session. All right, at the end of, let's see. Now for a quick demonstration before time runs out. So for this intervention, I've designed for this demonstration, I have an intervention in which there is let's say I have a little boy who has Down syndrome. He needs to go to a surgical procedure for a congenital heart disorder. And because of previous trauma, he's too scared to go in. The music therapy intervention is designed to help ease the client and provide them with a sense of relief and relaxation. So essentially, I ask the client what are 4 things that they think are what make them happy. So in his case, we would say bubbles, hot chocolate, mommy, and dogs. I would give him the mallet, and then I would point to the different tones, and we'd sing the song together. We'd go, I like dogs. I like hot chocolate. I like mommy. I love mama. And over the course of the intervention, I would have the client then verbalize the words himself. I would sing the verses and stop at the last word to let him kind of sing it himself as a way to kind of encourage him and give him some autonomy over the situation. That in itself helps give him some kind of control over the stressful situation, and the music activity increases the dopamine and reduces cortisol so that he can feel more relaxed and be more receptive of the anesthesias. All right. That's all. Thank you for joining me. If you have any more questions, go ahead and let me ask away. I have about 2 minutes left before this finishes up. So
I just think that it's really cool and interesting, and there's so many different things that you could help with. And you must be really excited to start this journey.
I am. I love this.
Cool. I'm excited for you. You did a great job today, and I really liked hearing all of your information.
Yeah. Like you would not believe the kinds of miracles that God can do just by using music. Things nobody thought could be possible are made possible by it and by God.
Yes. I think somebody's asking a question in the messages. Did you see that?
Are you familiar with therapeutic lost listening? I'm not sure I know what that is. Well, thank you all for coming and joining my presentation. I really appreciate all of it. And if you have any questions, I have a YouTube channel that I will be posting this on, and you can post it on the comments. It'll be yeah, if you have any questions, just go ahead and let me know.
Sure. If you don't mind, if you text me your YouTube channel, I'll send the link to everyone who's in the chat room that I invited.
Okay.
Okay.
Well, thank you.
Thank you.
Thank you.
Thank you so much. You did a really awesome job.
Thank you. Thank you for having me. God bless
Have a
your
good
day.